A common presentation with breast augmentation is a gap between the breasts. How do we narrow that gap is what patients ask commonly. And I like to try to give a 2-finger gap space between the cleavage. That's not achievable every time. It depends on where the patient's muscle is positioned naturally, how much breast volume they have, where will we be placing the implant. A few tricks that I have to narrow the space between the breasts is to place the implant above the muscle. That way we're not fighting the muscle for volume, but that's not appropriate for all patients, and we can determine that during the consultation. Another trick is to combine fat grafting with an augmentation with an implant, because then I can fill that area to narrow the gap. Another way is to choose an implant that projects more than the patient might desire to give that illusion that there is a narrow in the gap. So it's a common question. It can be very difficult in some patients, but before the procedure is performed, I'll tell you how likely it is to narrow that gap between the cleavage.